Hey guys, Dr. Naveen Narendranath here. How are you all doing? A lot of people here are getting really worried about this so called black fungus. I mean, the way our media operates, I think, is to gather traction through fear, it seems. Do you know that this fungus isn't really black, but when the tissues get affected, they turn black. They get necrosed, and hence the term black fungus. Many of my patients, out of fear, they've consulted with me online, asking me questions about this black fungus or mucormycosis. To tell you the truth, there's nothing new about this fungus. It's been there even before our grandparents, and it'll continue to exist even after our grandkids, if you're ever going to have one. So, allow me to tell you a few things about this fungus. Number one, it's present everywhere. It's present in air, soil, in damp, humid areas. It's basically all around us. Number two, it doesn't cause infection in healthy people, but usually only in immunocompromised people. So, why is everyone suddenly going crazy about this news? I don't know. The numbers have certainly increased. And just to give an idea, we would typically see one case in a year or two, but we are seeing about 2,000 cases in a few states. Uh, it's not alarming numbers given the sheer size of our population, but it's still definitely a notable increase for sure. To tell you the truth, we still do not have all the answers. In many doctors' forums, we are discussing technical aspects like levels of iron, ferritin, zinc, blood supply to sinuses, and things like that. There are many possible risk factors, and I'm using the word possible because there's still a debate going on with regards to these risk factors. I would like to think that those with uncontrolled diabetes, those with compromised immune system post COVID, maybe long term steroid or tocilizumab use, oxygen delivery through contaminated cylinders or ventilators, all these are possible risk factors, but we still do not know the whole truth. Anyway, what's more important is what we can do about it. There are few things you can do, few things us doctors can do, and there's a God above who can do everything. I think the most important thing here is to know what you can do to reduce this or tackle this. Please leave the treatment to the doctors, and I think we can focus on the prevention. The most important way is to maintain proper hygiene. Please keep the areas of the face and mouth clean. If you have diabetes, please ensure that it's under control. Avoid going out unnecessarily. Wear a mask, and at all times, please practice social distancing. And most importantly, please do not reuse the masks. A lot of us are guilty of it, but please try not to reuse the mask. Theoretically, since mucor is present everywhere, it can be present on the masks as well. And with the humidity in our breath, it's possible that the conditions could be favorable for it to grow, you know. So please avoid reusing your masks. Or if you have to, at least keep it in sunlight so that the microorganism load reduces, and you could also alternate between two or three masks. I think that would also help. If you're experiencing heaviness of your face or having some facial pain, or you have sudden onset of double vision, or you have lost vision in one eye, things like that, please feel free to contact your favorite doctors. We are, after all, here to help you. If you are healthy and don't have diabetes, you are very, very unlikely to get this problem. It would, if you're a number person, I think it would probably be less than 0.000001. You know, so I hope that makes you happy and feel more confident. I'll be covering a few topics like the so-called white fungus, which has come up in Patna, and about my views of the second wave. So feel free to follow and spread this positive message as widely as possible. This is not something we should really worry about. It's still a rare condition, and as long as you eat healthy, stay hydrated, and practice all the norms, I think you should be fine. So let's together help bring the levels of anxiety down. Stay home, stay safe, and please get vaccinated.